And action! Tracy had a question about dry skin. On her first evaluation today, she came in and I found that we had something called pilar keratitis. That's usually found on a lot of my young guys, especially football players for some reason, but it's on the back of the arms. Really big pores. They start out as big pores. It actually is dry skin. And then eventually those big pores get clogged up with oil, depending on what you eat. And then they become, or they blossom into acne, whether it's back acne or arm. It's a pain, it leaves scarring eventually, but it also is very dry. If you see my video on DrRic tutorial winter itch, it gives a little bit of a basic on what to do when it happens in the winter. Usually it happens in the winter because everybody takes a super hot shower because it's so cold, and I guess most men don't like putting moisturizer on. Most women are pretty good, but I don't like using moisturizer that has perfumes in it. Perfumes are usually alcohol based unless they're essential oil, and alcohol causes drying. And if you just go by feeling your skin to figure out am I moist or not, that's not good enough. Really, if you have pilar keratitis, you should be applying twice a day moisturizer. I like the ceramides, or any moisturizer with ceramide. This is CeraVe. This is something you can pick up at Costco. I'm not sure where you're watching this from, but Costco is a big box store near me. I also picked up this more intense ointment form of CeraVe. Ceramides, as you'll notice in my other video on winter itch, are waxy. And when you use these moisturizers that have wax in them, it'll be a little bit different than your usual moisturizer. There is no smell to this product line, and you can find your own. I think I even have a vino in my video with ceramide in it. The more ceramides you have, the higher the chances that you'll polish or get a nice polish and a nice coating to the skin. If you can seal in moisture before it evaporates, you'll keep the skin moist. If you keep the skin moist and supple, it won't have to throw so much oil out. You see, when the body reacts to its environment, the skin reacts to its external environment by producing oil. If you are washing excessively, washing or braiding too much, the body's going to think that's trauma. It's going to react by making oil different than before. If you don't have enough fluids, none of us drink enough fluids, especially my truck drivers, and that's okay. For my truckers, it's okay. I wouldn't want to pull over every 10 minutes, but if you're limiting your fluid intake and you're a little bit on the dry side, you might not feel parched. It might just be tolerable, and we might be able to ignore those signs, but not good for the skin, not good for the kidneys, not good for high blood pressure, but in this video, not good for the skin, and it makes the oil a little thicker. When the skin reacts to the external environment and the oil it's trying to produce to save the skin comes out thick, it comes out and blocks the holes, and when you block the holes, you get the acne that forms up. It's supposed to have oil that comes out just liquidy. You don't even see it. It just comes out to coat the top layer of skin and the shaft of the hair nicely without causing a sheen, and you're bulletproof to the environment. Then you can slough it off. And that's the other thing too. Some of my folks will just take the soap in the hand or bar and just go like this and use the soap. I think that's okay, but I would suggest, I'm not going to suggest a coconut, but I had nothing else in the office. No sponge here and no face cloth, but I'd suggest a form of sloughing off. Loofah, sponge, regular sponge, face towel, anything that has a little bit of abrasiveness to it. That way you can help the desquamation of skin that's loose come off with your wash. Don't go too hot, as I mentioned in my winter itch. If it's summer, you can go cool if you want. But and then the timing, doesn't really matter. I think the timing of your showers and the temperature of your showers can affect your sleep, so watch out for that. In Ayurveda, we want cooling at night. We don't want hot at night, but nobody likes to take a cold shower. Overwashing also. I have a lot of guys that will wash their hair 2 or 3 times a day with shampoo, maybe not conditioner, and that's a little bit over drying, but this is normal when you get grimy, I guess. So every time you wash, you have to put on moisturizer, moisturizing coat before you throw everything else on. And the moisturizer used for the body is a little bit than the one you use on the face. If you use too thick of a moisturizer, too perfumey of a moisturizer, it can actually work the wrong way. And again, you should slough off any loose skin. You should get a moisturizer that doesn't have any alcohol in it, maybe a moisturizer that has a lot of ceramide in it, and then you apply after washing. You towel down while you're in the shower, and then before any minutes go by, you apply the moisturizer while the skin is imbibed with fluid. If you put it on half hour later, the moisture actually evaporates and you sealed in nothing. If you take it in right after you take a shower and you towel it off, you can actually seal moisture in, and it makes for better skin. The skin is a big organ, so when that organ is kept up well, number one, you don't get skin infections. That's why diabetics have to really watch their feet, because sometimes they don't feel anything on the bottom of their feet. And if you look at an average male especially, I keep on blaming my guys, but most notorious for not taking care of their skin. If you look at an average male's feet, usually dry, crackly, and just a portal for bacteria to get in. And if you're a diabetic on top of that, you don't feel anything, bingo, you have infection. So moisturizer all the time. Again, using some kind of abrasive, easy on the face reacts a little differently, and then trying as best as possible to hydrate it if you can and avoid those things that cause fluids to pee off. That would be caffeine and alcohol. Those are diuretics. In addition, if you are taking a diuretic or a blood pressure pill, water pill, you're not supposed to take too much fluid in, because the water you pee off to lower blood pressure, if you put it back in again, it kind of offsets the effectiveness, but maybe a different medicine would be wise if you continue to have problems with your skin. Now, if you're parched, that's totally different. That's too much of a side effect. Can't have you doing that. It leads to problems with your teeth. So, Tracy, as far as pilar keratitis is concerned, you're not to the point of acne yet, but we want to prevent that from getting any worse. So habits would be important. Right after your shower and at the opposite end of the day, even if you're not feeling dry, when you change out of clothes from school or from your job, a nice thin coat to areas you can reach. I've always had a problem with getting it on the back, but I'm trying to invent something so it's easy application. I have my techniques, but that's also the area. And if you can take care of it before winter comes up, then you'll avoid that problem in the winter that almost seems like it's an allergy, but it's not an allergy, it's just dry skin. So good question, Tracy.